going to turn to a synopsis of our morning with Dr. Larry O'Connell and my colleague, Professor Susie Geiger. Susie is Professor of Marketing and Market Studies here at the UCD College of Business. And her current research is focused on collaborative market innovation in healthcare markets. In 2017, Susie was awarded a highly prestigious €2 million European Research Council Consolidator grant to carry out research into market failures in healthcare markets. I'm also delighted to introduce Dr. Larry O'Connell. Larry is Director of the National Economic and Social Council and is also Chief Executive of the National Economic and Social Development Office. Larry is also a graduate of the UCD Smurfit School, having completed his PhD study with us here. As an expert in public policy, I invited Larry to listen to each of the conversations throughout the morning, and together with Susie to synthesize the public policy themes and the calls to action emerging from all our conversations. So now over to you, Susie and Larry.
Thank you very, very much, Gerardine. Larry, I'm absolutely delighted to talk to you today. Larry, we have the not so simple task of condensing what have been 4 absolutely full hours of facts, expert opinions, and dialogue on how best to navigate our country through these extraordinary times. So maybe I could ask you, in your position as the director of a body that advises the government on economic and social issues, what would be the top 3 lessons that you would relate to our Taoiseach from this conference today? Larry, can you hear me?
We've lost Larry for a moment. I think we're getting him back there, Susie.
All right, okay. Larry, are you with us?
Can you hear me now?
Maybe Susie, oh, here we are. You're back, Larry?
We are.
Okay.
Yeah, we can hear you, yes. Thank you, Larry.
Great. Thanks very much, Susie. It's really been a fascinating morning. I have to say, like lots of people, I was very maybe disappointed that I couldn't go and watch my kids play football this morning, but I've been inspired in different ways by the conference. As you say, it's quite a challenge, you know, to have listened to such a wealth of information over the last 4 hours and to try to pull that together. So to your question, I mean, I think I actually, like Gerardine, I really thought that Michael Dowling's phrase of bottling the energy really captured something for me. And so my 3 lessons that I think, at least first pass, would say in terms of advice would be, I mean, the first one is, I really feel, having listened to this morning, that it truly is a collaborative project in terms of how we solve the COVID crisis. And it is not just a government-only project. And in a lot of the public policy areas, the advice and the recommendations tends to come back to government to say, this is what you need to do. Whereas what I think was very clear this morning is there's enormous positivity, there's an enormous amount of people who are problem solving and working out how to move forward on different aspects of the crisis. I mean, we heard from the Comfort for COVID, the pharmacy initiative, giving the keys, and all of those, and the local doctors, you know, doing the communication on media, etc. All of that suggested that there are people out there who are trying to solve this problem. And I was really taken with Professor Harvey's term, what she called ripple intelligence, which I hadn't heard of before. And I really think that's interesting, because as I understood it, what she means is it's the ability, you know, to generate insights, if you like, around corners, to see all the angles on a particular problem. And I think that's quite interesting for government to grapple with the question of, well, how do you generate that type of ripple intelligence in the face of this crisis? So the message of it is a collaborative project, and I think it really came out of the morning, this sense that what we need to do is to continue to ask for help. It was very evident that in one cohort with young people, that's what we really need to do. And I think Fergal Hines' you know, analogy that in climate change, people are engaged. Well, young people are, because they feel they can, you know, they want to affect change in that area. We need to look at how do we do the same maybe for younger people in relation to this challenge. The second lesson I think is, and I'm not a health expert, but I really do think that it's an important message to say that practitioners from across the spectrum on this call this morning are arguing that the health system has now been revolutionized. And the issue is, how do we now build upon that and maximize it? I think, again, Mike, he was very interesting. He also talked about a bottle here. He said, the genie is out of the bottle now on virtual medicine and telemedicine. And the layers have been removed in the health system. Somebody else talked, I think Alan talked about that layers have been removed and that solutions are now coming up much more quickly from the front line. And that, in a sense, we really now need to figure out, well, what do you do now to build upon that? Two specific things came up. One, I think, was around an investment in IT and data systems. I think somebody on the chat even went more specific that we need a national telehealth strategy. I think they are very concrete messages back to government that we need to do more. There was a specific reference that people on this call would know about the electronic health records. And the fact that we don't have that probably is limiting our ability to capture the wave associated with digital. The third message I would say is, I really think it's very interesting that, again, across the call, people were talking about the importance of granular data, and that we need to dig deeper. So it started this morning with, with Dr. Glynn talking about the need for granular data about community transmission. We had Mark Lawler talking to us about cancer treatment, telling us in really graphic terms the difference between real data and national data. And so I think there's a real sense that, if the third message is that we need to dig deeper into the problem, that we need investigative studies, that we need to have studies on obviously some of that is around medical issues and epidemiological, but it's also around social sciences and not just behavioral economics. I think what's coming through is we really need to dig deeply to understand exactly what's happening around this disease, and that came through. So they were my three messages, Susie. That's
fantastic, Larry. I'm going to pick up on one of them because I think it's emblematic of what we may wish to see happening, which is the context of digital health. And Gerardine and myself, actually, and Mark Lawler and a few other people on this panel go back quite a long time in relation to digital health. And, the country has had an e-health strategy for the longest time, and Europe has had an e-health strategy for the longest time. And we've seen lots of pilots and lots of good things and lots of ambitions and, lots of willingness. And I think that's emblematic for a lot of the things that happen in society and the economy all the time, because innovation, I think the Irish have always been very good at being innovative, and we've heard words like creativity and openness and collaboration today, but there is a sense that while innovation is happening, there may have always been a certain barrier at scaling this innovation. The blockages, the silos, the problems of just rolling it out in a large scale. So, taking the example of digital health, or any other example that you wish to take, what can we do now in the space of innovation to really make sure that all the wonderful things that are happening now can be rolled out, can be scaled, and can bring us forward into a post-COVID future?
Yeah, I think you raise an interesting issue about the point that we maybe don't learn from success quickly enough and champion it. I think this crisis maybe has helped to change that a little bit, in that where people have been found to come up with solutions, they've been rolled out and used, and we heard lots of stories about that this morning. And again, I think so the challenge is then to build on it. I think maybe 2 or 3 interesting things came up on this morning's conference. If I understood Alan rightly, when he talked about the industry and innovation, I think he talked about the idea of a forum on innovation where you collaborate even more widely with industry. I think that would be quite interesting. I was also very interested, I suppose, in as I listened to Mike Dowling, and I felt, we have lots of companies now that are having breakthroughs in terms of this space, in the health space, and in terms of figuring out how to use data. I myself was just reading about a company, Blue Metrics, and I was saying, so here's an example of a company which has huge success with Imperial College. do we need some type of board BIA for those type of companies now, you know, to ensure that the expertise that's being used and discovered in an Irish or in a European context is available globally to other providers? And I think trying to think about that, how the innovations here that are discovered are actually used, would be critically important. I just going back to the final part on your question about the e-health. I mean, I think it is important that we have the strategy in place, and sometimes in Ireland we're inclined to then think, well, the problem was that we just don't implement what was a really good strategy. And I suppose I'm always a little bit nervous of that, because I think you have to also grapple with why have we not implemented it, and what are the issues that are holding it back. And I think maybe now is also a time to do some of that. And we clearly have some issues around protocols and privacy concerns around data, or something that's holding us back. And I think that, rather than actually just saying, let's take the strategy we had and implement it, we need to grapple with understanding, again, people who work with this at the front line, why is it so difficult to implement a strategy that seems to have been implemented in other countries quite well? So.
Mm-hmm. Can I pick you up on that? Actually, I'm in a consortium, research consortium, looking at COVID tracking apps rolled out across Europe, and people's perception of these COVID apps across 9 different countries. And there's obviously such a variety, and we've talked about that this morning earlier on, that, you know, there seems to be a certain amount of collaboration seemed to have been lacking, if I may say so, between European countries, certainly in that area, but maybe also in different areas. So how can we make sure, as public policy expert, how can we make sure, in your opinion, that going forward, we can pull lessons learned together from our European and global colleagues, and, you know, we don't have to repeat every sort of trial and error learning curve there is ourselves? Yeah.
Well, absolutely. And I think it has also been a feature of the response to COVID, that we have been trying to look very, you know, certainly in the within the civil service, there's been an enormous effort to try to look at what's been learned, what you can learn from other countries, so that we're not reinventing the wheel. So I suppose it's a question of then trying to look at how in the various areas that we can do that going forward, and we don't lose that sort of ability to do it more. I mean, I think we've always done it, but maybe to do it more quickly. I think that would be a kind of key part of it.
Michael Dowling said something very interesting. He said managing is the here and now, and obviously there's so much managing, crisis managing, to be done in the here and now. But he also said that leadership is about 5 years into the future. So I'd like to, you know, zoom fast forward 5 years into a hopefully post-pandemic future. And, you know, this pandemic has been the biggest collective learning experiment we've probably ever undergone, and lots of lessons have been learned and lots of curves have been climbed. What's your sense, you know, from a systemic perspective, what are the very long-term implications likely to be from this pandemic in the areas of, you know, the economy, society, political leadership, and public health?
Yeah, I mean, that's I mean, a really interesting question, and I think, you know, in one sense, I agree with Mike about the difference between management and leadership, but I also think it's very important. What lesson that we've learned from the crisis is that a key part of the leadership is being in the present and being able to respond to it really rapidly. And I think one of the things that we've seen, I mean, you know, people say, well, what might it be like in 5 years? And it's actually probably difficult to predict what it'll be like in January, you know. So that brings me to think, well, along with, you know, studies or scenarios where we're trying to look to the future and imagine, will the economy, you know, how will it be impacted by digital technologies, that we really need to look at how we're actually responding to sort of day-to-day changes. And one of the ways to do that is to really track closely what the innovators are doing, the problem solvers, the people at the front line, the entrepreneurs. They're the ones that are going to give us weak signals as to where this system is going. So I sort of sense that the system is beginning to think, well, let's never get caught up again like this, so we should have foresight and planning, and I think that's reasonably okay. But just to make it clear, the National Risk Assessment had a pandemic of this order, was in its assessment last time. So the issue is, you can identify the risk, but how will you get people to act upon it? And so I think that's one part of the puzzle, to do the forward looking. But I really think you have to engage with people who are at the front line, who are coming up with new ways of trying to solve the problem, and try to see how can you read the intelligence that they're gathering. And I think that's what we need to do as well in the system. So I know I haven't really answered your question, but I think it's a very difficult one to answer. But I really think part of it is by really watching closely what we're doing on a day-to-day, and then having, as Mike exactly said, then having the agility to respond in real time to the data as you get it, to say, now this is the way the future is shaping. So that would be my
It's been interesting, hasn't it, to hear sort of the buzzwords this morning, you know, agility in the face of this uncertainty that we probably have to live with, you know, flexibility, creativity, openness, collaboration, community, solidarity, obviously being a very, very big one, and equity here. So I think, you know, that's the sort of the positive resonance is certainly that I'm taking away from this morning. One final question, Larry, and I think that's going to also bring us into the next session. We've had an absolutely stellar set of panelists here today with us, and over 300 audience participants. You know, there's so much, you know, brain power and willingness and enthusiasm, not just here in this virtual room, but everywhere out there. For a network like this, you know, a leadership network of various, you know, disciplines and you know, coming from all sorts of walks of life, what would be the next sort of pressing steps for a network such as this one today to take? So, you know, if we had to formulate a sort of a call to action and a plan, what would you advise, again, from your perspective as a public policy and economic expert?
Well, I mean, I think that it would, one level, it would be fantastic to have some type of record or report of the proceedings to try to capture some of the energy that's in the bottle, as you know, and to try to reflect that, and you know, along with some of the very concrete things that I think people are suggesting need to be done. I think, and they're positive, and I think that's, you know, would be a really good outcome. And I think there's a sense, I think, that, you know, as I said at the start, that this is a collaborative problem, and I think, you know, government have been reaching out really, really well in terms of engaging with people. So I think there is an appetite for input that can come and say, well, here's perspectives on the problem. So I think in the short term, some sort of outcome like that, which you may have had in mind anyway, would be extremely useful, I think.
Yeah. Well, I think the hope is that the word for, you know, the word for 2020, the word of the year 2020 will not be COVID or Corona or crisis or pandemic, but will be solidarity or community, something like that. Yeah. That would certainly be the more desirable word of the year. Gerardine and Mary, at this point, would you like to come back into the discussion?
Excellent. Thank you so much, Susie. And thank you so much, Larry. And thank you for taking the time out from that football game. I hope you'll be forgiven for missing your son's football match. It's been a pleasure. Thank you so much for synthesizing the conversations here this morning, and for sharing with us what really resonated with you guys. I would like to say that, yes, indeed, there's going to be at least 2 tangible deliverables and outcomes from our conversation this morning. One, indeed, will be a report. So we will bring together all of the conversations, the recommendations, etc., and the experience. And then secondly, we've also had a fabulous illustrator with us here this morning, Philip, who's been frantically drawing away and reflecting in his drawings the themes that have been emerging for him and resonating with him. So we will have those 2 deliverables in the foreseeable future coming from, over the next few weeks, coming from our conference this morning. So a huge thank you for helping us to synthesize what has been an incredible morning, and hearing from our leaders in all of the various different sectors within our society, within the economy, within our healthcare system. And it's been really fantastic. And what's also been really wonderful is, particularly over the last few conversations with Susie, yourself and Larry, is the optimism and the positivity that you express, as reflected in Mike and his forward-looking and wishing to bottle the creativity and the passion and the innovation. And absolutely, as you say, Susie, the solidarity, and hopefully we will continue that within our society moving forward. So a huge thank you to both of you for taking the time out to be with us here this morning.